from Buffalo, New York. Here protesting today in Rochester. We have a decent turnout and lots of responses from vehicles passing by, ton of pictures taken from car windows, and mostly positive response. It's been a great day.
And you're a board member of Bloodstained Men and their friends?
Yes, I am. Since a couple of years ago, and initially worked in the capacity as press secretary, but my growing family had to put the stop on a lot of the work that I was doing, so I am now involved in helping to decide how Bloodstained Men goes forward and how we build momentum and how we grow this movement.
And you mentioned your family. You have 3 children, and you've brought your newest addition out here to the front lines.
Hi, baby.
And she's making good use of one of our signs. Oh yeah, she's found out the best way to use a sign. Well, congratulations, she's beautiful, Erika. So you were pressured in the hospital to cut your 2 older sons. They're, what ages are they now? 6 and...
My oldest is almost 6, my middle child is 4, and I was asked repeatedly in the hospital both times about circumcising. It was very clear that we weren't doing that.
Was that in Buffalo?
That was in Buffalo at Women and Children's Hospital.
Who asked you?
Well, with my first child, it was in the room after I delivered, so it was my, whatever nurse was my nurse in rotation. It was like she was going down a list of things that had to be answered, but they didn't keep the answers stored, so each time they would ask, and what about circumcision? It wasn't very pushy with my first child, but with my second child, his pediatric nurse, while I was in the recovery room after my C-section, was really pressuring me to circumcise him. I have an intact son at home and am an advocate for genital autonomy, and her pressure was really inappropriate. I actually reported it, and she ended up getting written up for that.
Do you recall any of these specific things she said that you reported?
She told me that in her capacity as a pediatric nurse, she had seen horrific infections, and that to avoid that possibility, it was really the best thing. Plus, he might be embarrassed in the locker room.
So she brought in the locker room.
I mentioned my intact son at home, and that foreskin is erogenous tissue, and that I didn't want to be asked again, and that my son was healthy and happy and normal and would be keeping his body intact. A lot of nurses don't have accurate information, and especially the ones that circumcise their own sons have a heightened level of cognitive dissonance about what that meant for their son and his loss. Even when given medical information that clearly proves the value and function of the foreskin, many women deny it and shift to another argument, like a cultural argument or a religious argument or matching daddy or whatever it is. They have a very hard time objectively looking at information that then implies that they made the wrong choice at some point, or that they have assisted in the abuse of boys. It's a very hard pill to swallow, I think.
And you say she got written up?
She did get written up.
How did you find out that
My
fact?
midwife told me that she was written up. I think she just probably heard through the grapevine.
Now that leads us into an issue I would like to talk to you about. Can you imagine, well, twofold. If they are behaving like this, pressuring parents like this, it indicates it works. And can you imagine...
I mean, new parents that don't have any information really rely on their medical care providers to offer them complete information and give them informed choices. In the case of circumcision, they almost never give true informed consent. I mean, ultimately it's not true informed consent because the boy is not deciding for himself, but even with parents, they don't talk about the anatomy of the foreskin, the functions of the foreskin. They just talk about how, babies need to be normal and match their dad. I was so close to being a regret parent. I found out about circumcision very late in my first pregnancy with my son, and really only by happenstance. We had been asked by my provider whether or not we wanted to circumcise. We looked at each other and shrugged and said yes, because that's what our experience is as normal. Knew nothing about circumcision. And
that was the first time it didn't even come across your radar.
About it, yeah, which I find really strange in retrospect, because I'm kind of a I like to learn about a lot of different subjects, and it's just strange to me that this never crossed my radar, but it didn't. And so after that checkup with my midwife, we went home and I looked up circumcision, and I watched some videos, including the procedure, and was horrified, and my husband was as well. And not only did we decide to leave our son intact, but I went back to my midwife and exclaimed to her, like, you know, why didn't you tell me the truth? I can't understand why you wouldn't provide information. We've changed our mind, we're not doing this. She had a big sigh of relief. Oh, I'm so glad. I hate doing them.
So she acknowledged in that statement that she herself, the midwife, does circumcision.
She does perform
which
them,
is legal in New York State.
She hates doing them. However, she says that she'd rather do it than somebody else because at least she knows that she lets the medication kick in long enough and doesn't take too much skin and blah, blah, blah. Which is ridiculous. I told her, you know, you're in a position to advocate for these boys. New mothers are going to listen to you. They don't know anything about this subject like me. Had you said to me, it's completely unnecessary, very painful, and foreskin is erogenous tissue, I would have made a completely different choice initially. I just didn't have any information. That's the problem, lack of information.
What did she say?
She said that a lot of patients are very sensitive about this subject, and she didn't want to alienate us, but she didn't know what our religious beliefs were, blah, blah, blah. And I told her, you know, you are in a position to have a much stronger stance on this issue, especially if you don't like doing it and you agree with the intactivist argument. You have a moral responsibility to advocate for boys with your patients, and they will listen. They're coming to you for a natural birth experience, and they haven't realized that circumcision is the antithesis of that. You know.
Do you know if that had any positive effect on her midwifery?
I don't know, and for other reasons, their practice broke up shortly after my second son was born, and now they are working in other clinics, so I really don't know what they're doing at this point.
Do you ever see her around?
No. We are Facebook friends, so I know she sees all of my circumcision posts, but she never interacts with them.
Interesting.
So, yeah. But, you know, regret parents that have done this to their son and then come to the issue again and change their mind. Maybe they have another son and they leave him intact. Those that speak out about this, I have nothing but the utmost respect for them. I mean, I can't imagine that road, walking that road. It would be so painful and so difficult, and those that have walked it are, you know, just a stellar example of what parents really should be. And they are so important to our movement, and we just, you know, we really need to find new ways to reach out to them that helps them to understand the intactivist argument without alienating them by inspiring feelings of guilt or whatever. So it's very hard. Very hard.
Well, we all were born into a circumcising culture.
Right.
We all were born into a culture that told us it was no big deal, that it's normal, and we see it out here on the front lines. You know, the people that go by and giggle and, you know, call us crazy
Get a
and
job.
Don't you have anything better to do? And like, really? All the issues in the world?
They don't know. They have no idea. I bet.
And those would be the first people to say, oh, but female circumcision, oh, no, that's bad stuff.
Those people don't really know anything about circumcision, and I bet if they watched one with the sound on, they would change their mind almost instantly, as I did, as my husband did, as so many people do. Because it's obvious, especially if you already have a child. You see this baby strapped to a board, screaming the most horrific animal torture sound. It's like almost inhuman.
It is.
Babies are not supposed to cry like that.
There is no other cry like it. I mean, it's the closest is when you see some of these shows on nature where the creatures are being devoured alive, you know.
And that's what a baby must think is happening. I mean, they are forming connections at the most rapid pace of their life, and they are experiencing extremely painful primal trauma, and it changes the wiring in their brain forever. I don't really know that we have a full handle on how that can manifest in people, but there's a correlation among countries who circumcise and violence in those cultures, so certainly that's something that needs to be looked at. And
now, Erika, you are wearing the bloodstained woman suit with one of many women who are wearing the suit in protest these days on the front lines. I recently interviewed the renowned birth attendant Gloria LeMay, and she said that and she wore the bloodstained suit at our Bellingham, Washington protest a few months ago, and she said when she first saw women in the bloodstained suit, she was just absolutely stunned, floored, and she decided that if she felt that shock, she had to do it because of all the taboos against it, you know, with women, and you know, the whole issue of your monthly cycles. So
well, that's what my husband painted my pants, and
your husband actually helped you design it too, didn't he?
Yeah, he did. It was his concept, and I really, you know, I have some of those similar feelings. I want to stand in solidarity with those wearing the bloodstain, but it does feel confusing to me because of menstruation. So I think this is really a happy medium. It's a bloodstain, but it's clearly not a menstrual bloodstain because of its shape. It's attention-getting, and I think you did a great job.
Thank you for coming out here, and thank you for your work with Bloodstained Men, of course, and thank you for coming out here to the front lines in Rochester with us. You were in Buffalo with us yesterday.
Yes.
And appreciate everything you and so many other moms around the nation are doing to help the Bloodstained Men and their friends move this ball across the goal. The sexual mutilation of our nation's sons is unacceptable in the modern age.
Yeah, the more I learn about circumcision, the more I understand how its impact just reverberates through every aspect of our culture and every aspect of the circumcised man's identity, and it's a really complicated issue to navigate, but it is the human rights issue facing men in this country, and maybe facing humans in this country. And until baby boys have the same rights as baby girls and the same protection to keep their body intact, I won't stop speaking about this.
Thank you, Erika. Appreciate it.
Thank you.